Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan. In today's video, we're going to talk all about anorexia. Anorexia is one of the more commonly searched conditions. So if you're wondering, what is anorexia? What are some of the psychological effects of anorexia? And how does anorexia impact the body? This video is for you. So if you like it, hit the like button, subscribe, click the notifications tab, and here we go. So eating disorders, as I mentioned, is a fairly commonly searched condition. And we do see that Western society has equated thinness with health and beauty, whereas other parts of the world do not equate thinness with beauty, and that explains why there is a higher rate of eating disorders in westernized nations. So if you were to think about it, thinness has become quite the national obsession, and we see for the past actually now it's about 4 decades, there's been a rise in the diagnosis of eating disorders, and the core issue is fear of gaining weight. Now, in the DSM-5, there are more than 2 eating disorders, but the 2 main diagnoses you probably have heard about are anorexia nervosa and bulimia nervosa. The DSM-5 did add binge eating disorder as an additional eating disorder condition after about 2 decades of research, but I will leave that for another video. Today, we're only going to talk about anorexia nervosa. So when we think of anorexia, we tend to see that a person is intentionally or purposefully taking too little nourishment, resulting in a very low body weight. So the threshold to meet a criteria for anorexia is to be 85% of the expected body weight. And but what's the motivation? We see that one core feature is that fear of becoming overweight. There is also a distortion of weight and shape. So it's not uncommon for a person with anorexia to look in the mirror and see themselves as heavier than they really are. And that creates some really disturbing feelings. And then in some cases, people actually develop amenorrhea, which is the loss of one's menstrual cycle. This tends to occur due to malnutrition and reductions in leptin. But when a person gets the proper nutrition and restores their body weight, most people do regain their menstrual cycle, which obviously is vital for having children. So there are 2 main subtypes of anorexia. There's the restricting type, where a person loses weight by cutting out sweets and fatty snacks, and eventually they're restricting it to nearly all food. And there's a sense of rigidity and structure, that there's very little variability in their diet. So the restricting type, they're just cutting food out. Whereas a binging and purging type, this you might have probably heard more in the context of bulimia, but there is a binging purging type of anorexia as well, where a person is losing weight by forcing themselves to either vomit or take laxatives, diuretics, or whatnot. So it's not uncommon for these individuals who are engaging in these processes to lose their satiation. So when you purge, you might feel hungry, which is going to induce an additional binge. So if we were to look at the prevalence of this condition, 90 to 95% of the cases of anorexia occur in females. That doesn't mean that males can't have anorexia. In fact, if we look at certain athletes, such as jockeys, they have higher rates of anorexia. If we look at models, male models, there's higher rates of anorexia. So even though I say 90 to 95% of the cases are female, it doesn't mean that it doesn't affect males as well. The peak onset is during adolescence. So there's about 14 to 18 years old is the typical time when this manifests, and anywhere between 0.5% to 3.5% of females in Western societies develop the disorder. Now, that is meeting the criteria for the DSM disorder. It doesn't mean that there aren't others who display symptoms of it, such as dieting or body dissatisfaction. There are people who are subclinical levels engaging in symptoms like this. And as I said, Westernized nations, we tend to see higher rates of anorexia than other places. So North America, Europe, and Japan, we see a lot of this. Now, Japan technically is not considered a Western nation as in an individualistic sense, but in terms of its ideology, it's far more democratic and whatnot. So what is the typical case of a person who eventually develops anorexia? Well, it's common for the person to start out slightly overweight, typically female, who started a diet. And when they diet, they start to get positive feedback. Oh, you're looking good. Wow, you're doing great. Things like that. And that motivates them to continue to lose more and more weight, to continue to expand their restrictions, and eventually that turns into anorexia. Not every case of dieting does, but that is the common case. We also know that cases of anorexia can occur as a function of stressful events, such as parents getting divorced or separated, moving away from home, going to college, getting some harsh negative feedback, personal failure. These are stressful events that really occupy space in a person's mind, and this individual might want to feel a sense of control over something in their life because they can't control things like divorce and separation or other aspects of failure. So they feel more empowered by this. We also see that the vast majority of people who have anorexia with treatment do recover. However, there's about 2 to 6% of people who do become seriously ill and ultimately die as a function of either medical complications or death by suicide. So, what is the goal? If you were to say, well, what is the driving factor? The driving motivation is fear, and the goal is to avoid becoming obese, avoid giving in to one's desire to eat, avoid losing a sense of control over their body size, shape, etc. These are the goals. Now, what's interesting is that we know even from the 1940s, from the famous starvation studies, that starvation and restriction of diet results in further preoccupation with food. And on a less extreme sense, if you've ever fasted, at the end of the fast, you're probably obsessing about what you might eat to break that fast. Now, it's a correlational thing. It's not the food deprivation that leads to the obsession. It could be the obsession that leads to food deprivation. And it's really a cycle that it goes round and round. So regardless, individuals with anorexia, even despite the dietary restrictions, there is this preoccupation with food. So they're constantly reading about food, planning their meals, making sure that they don't, gain weight. And in terms of cognitive issues, there's a whole host of cognitive distortions. So we see people generally start out with a low opinion of their body shape. They're not happy with their body. And even after losing weight and developing anorexia, there's still not a satisfaction. There's constantly, yeah, but I have this to lose. I've seen people like pinch the skin under their arms and say, see, I have more to lose in the case of anorexia. We also understand that there are absolute actual distortions as well. So if you ask a person to uh, adjust, on a picture between which two models they might be, there is an overestimation of one's body shape by anywhere between 15 to 20%. So looking in the mirror, the person actually believes that they're larger and more of a weight than they actually are. So that's pretty cool that the adjustable lens assessment strategy does demonstrate that it's not just in the abstract, it's the person will report, hey, I weigh this, or here's my body proportions. Now, other cognitive distortions or misperceptions is that they need to be perfect in every way. So anyone who has made a New Year's resolution to lose weight or whatever, you know what this feels like. You make the commitment, and then one day you have a bad day. And then that bad day turns into 2 bad days, and you're like, well, I already cheated. I'm no longer doing it, so I give up. So that mindset is on a more extreme sense with people with anorexia, that they must be perfect. They cannot have a bad day. And there's more of a self-punitive mindset. We also see that people say, well, if I deprive myself, then I'll be a better person. I think there's in the pro-ana websites a saying that nothing tastes as good as skinny or something of that nature. There are these phrases that push deprive oneself, and then because of needing to be perfect, what happens if you give in? You feel shame, you feel guilt, etc. So having the mindset that I can avoid guilt by not eating is another cognitive issue. So what's interesting is that anorexia does co-occur with other psychological problems, other psychological disorders, as well as psychological factors. So we see that depression and anorexia are linked. Anxiety and anorexia are linked, low self-esteem, insomnia, substance abuse, OCD patterns, and perfectionism. All of these are clinical features that we commonly see with a person who is diagnosed with anorexia. Again, it is not everyone, so I don't want you to think that your client or you are going to experience all of these symptoms, but we see common trends. Now, what does this starvation do to the body? So if we were to look at some of the medical problems associated with anorexia, it's pretty widespread. So things I mentioned, amenorrhea, the loss of one's menstrual cycle. We see a drop in body temperature. We see a drop in blood pressure. We see body swelling, bone density problems, reduced heart rate, electrolyte imbalances, loss of one's hair, dry and brittle skin and nails, and poor circulation, and so forth. This condition really is going to affect many bodily systems, your cardiovascular system, dermatology, a whole host of things. So anorexia is a very difficult thing to deal with. And I hope this video was helpful to shed light onto, well, what are we looking for in clinical practice when attempting to screen or diagnose for anorexia? What are the common cognitive ideologies and distortions? And then what are some co-occurrent psychological and physical problems that we have to keep track of? So once again, that's anorexia. If you like the video, hit the like button, subscribe, click the notifications tab. That will allow me to bring this video to a larger audience. Take care, everybody.